Hello, everyone, and welcome. My name is Gary Parker. I'm the Associate Dean for External Affairs at the Brown School, Washington University in St. Louis, where I also have the great privilege of directing the Clark Fox Policy Institute. And welcome to Open Classroom. This is an opportunity for the school to kind of open our virtual doors and invite you in to hear from some of our incredible faculty, alumni, students, and others talking about their research and some of the amazing work that they have going on. I want to let you know that your cameras and microphones have been disabled, so we can't see or hear you, but we want to hear from you. So please use the chat feature throughout the entire presentation to send us your thoughts and your questions. My co-host, Janet, and I will curate those and then deliver them to our speakers, but we definitely want to make sure that your questions are answered. Also, if you have resources or things that you'd like to share, you can also put those in the chat feature. You can change the feature to all panelists and attendees, and that way you'll be sharing them not just with us, but with the other attendees who are here for today. Before we start today's program, I want to let you know that this is part one of a double header. We have part two coming up today at 3 o'clock, where we will be hearing from iChat and Smart Africa speaker series, who are featuring an alumni, Dr. Charita Castro. She has been working on the issue of where is it? I think it's youth labor, right? Isn't that what it is? Social work, child labor. Yes, that's right. Child labor globally. Thank you, Janet. And she'll be talking about that from 3 to 4 p.m. Central Time. Although it's too late to register for that, you can view that via our YouTube live stream, and I'll put a link to that live stream in the chat feature, which today's is also being live streamed. I also want to let you know that on the 24th, which is Thursday, at 6 p.m., we are hosting a town hall. It is the Violence Prevention Commission's town hall on the St. Louis Metropolitan Police Department Collective Bargaining Agreement. It is being done in partnership with Homegrown St. Louis, which is directed by our own Professor Sean Joe here at the Brown School. And that we'll be hearing from Jessica Myers, and the public is invited to come and give comments on really thinking about police reform and how that can be infused into the collective bargaining agreement with the St. Louis Police Department. That you can register for. And again, that's on the 24th, Thursday at 6 p.m. And I'll put a link to register in the chat feature. With that, I'd like to please welcome my co-hostess with the mostest. Please give a warm welcome to the Director of Professional Development at the Brown School, Janet Gillow. Hello, Janet.
Hey, Gary. Thank you so much for that. Welcome, everybody. I am very excited about today's program, and I've come to it because we as a school, and myself personally, we believe in science. Having an opinion is one thing. Having a theory is better. Having a theory that's supported by data, where you're refining your understanding to create a model to understand the world, inform policy, that's better. And especially in this time where science, more than ever, I think, saves lives, I'm just so excited to hear from today's presenters. So you're going to be hearing, this is part one of a two-part presentation, and we have about half of the team with us today. The other half is going to be speaking to us on November 17th. Their study is COVID-19, an exploratory investigation of the determinants of the mitigation interventions in the U.S. And today joining us, we have Linyun Fu, who's the manager of global programs at the Brown School. She's also a 2015 alum of our MSW program. We have Yuanyuan Yang, a third-year PhD student from the Brown School, and Shenyang Guo, who is the Frank J. Bruno Distinguished Professor of Social Work Research. His work focuses on child welfare, child mental health services, and healthcare. He has expertise in applying advanced statistical models to solving social welfare problems. Right now we have a few social welfare problems. So I am super excited to hear cutting edge findings from this wonderful Brown School team and introduce Dr. Gao to lead us off.
Okay, good afternoon, everyone. Thank you very much, Gary and Janet, for organizing this and inviting us to give a talk. Let me share with you my PPT first. Thank you all for coming. It's our great pleasure to share with you findings of our most recent study about the mitigation interventions implemented in the US during the first 5 weeks of the pandemic. Today, we will present the part 1 of the study. Some states may have missed the optimal timing to enact virus mitigation efforts. Findings of the determinant study. On November 17, our team will present the second part of the study, the impact study. Our research team is comprised of Dr. Rupert An and Dr. Tim McBride. Both are professors at the Brown School. And Dr. Danlin Yu, who is a professor at Montclair State University, who is an expert on spatial modeling. And Linyun Fu, the manager of global programs at the Brown School, and Yuanyuan Yang, our third-year doctoral students in social work at the Brown School. Our paper was pre-printed on medRxiv site on May 29th, and officially published by Research on Social Work Practice. So these are the links to our publications. To our knowledge, our study is the first explicit analysis of the timing, determinants, and the impacts of mitigation interventions for all states and Washington, D.C. in the United States during the first 5 weeks of the pandemic. We have received many good comments from the Impact Foresight medRxiv. The latest case count of COVID-19 in the US. As of last Saturday, September 19, more than 6.7 million people in the US have been infected by the coronavirus. And the death toll has approached to 200,000. Very sad. On March 13, 2020, President Trump declared a national emergency to combat the coronavirus pandemic. Following his declaration, 42 states and Washington, D.C. enacted stay-at-home orders and other mitigation interventions. The unprecedented implementation of the mitigation interventions has dramatically influenced the American society. It has cost tremendous economic resources. The CARES Act alone costs more than $2 trillion US, in addition to other types of direct and indirect costs, such as the closure of business and the dramatic reduction in GDP. Many people lost jobs. In the 7 weeks during May 2nd, 33.5 million people made initial claims for unemployment in the US, a record number of unemployment claims. The official unemployment rate reached 14.7% in April, the highest rates observed since the Great Depression of last century. Preliminary studies have found that minorities experienced high risks of COVID-19 infection and high fatality rates. The most pervasive disparities are observed among African American and Latino populations, and where data exist, American Indian, Alaska Native, and the Pacific Island populations. Undoubtedly, policymakers are facing a tough decision to make: how to balance between economic and the public health interests. Which strategies should be undertaken at which time points in order to maximize utility functions? Sorry. Sorry about that. Motivated by this interest, we aimed to address two research questions in this study. Why did some states in the United States respond rapidly to the pandemic, while others did not? Is an initial response observed? We employed a mixed method in this study. We first conducted a content analysis by examining 1,470 government documents to categorize the type of mitigation interventions. And more importantly, we documented the timing each state enacted these efforts, measured in hours, using noon of March 13, the US Eastern Time, as a 0 hour. Noon of March 13 is the timing when the national emergency was declared. The determined study defined the study window from 12 p.m. March 13 to 6 p.m. April 7. The ending point is 1 hour after the last enacting state, South Carolina, implemented its stay-at-home order. They did this at 5 p.m. April 7, US Eastern Time. So we just use 1 hour later than 5 p.m. as the closing point for the determinant study. The impact study defined the study window from March 11 to April 15. We purposefully choose April 15 as the ending point in order to evaluate the net impact or net effect of mitigations, rather than spillover effects resulting from both enacting and lifting mitigations. We carefully choose a closing point of the impact study in such a way that the study window does not cover any period in which mitigation was first enacted and then removed. We employed a proportional hazards model, particularly the multiple event survival model, to study the determinants, and a random effects spatial error panel model in conjunction with indirect INT, the inverse normal transformation, to study the impacts. In our paper, we described the details of our models. So today I'm not going to talk about those technical details. For those of you who are interested in our methods, please read our paper. The theoretical framework guiding the current study is the social determinants of health, so-called SDOH framework. Initially developed by World Health Organization, the social determinants framework emphasizes the strong relationship between societal factors and health outcomes. To adapt this framework for the US, the National Academies of Science, Engineering, and Medicine organized a special group to further articulate strategies for integrating social care into the delivery of health care to improve the nation's health. The academic's report was published on September 25th, 2019, just last year, September. They published the report. Immediately following its publication, a congressional briefing was convened to discuss the implementation of SDOH-related strategies. The academic's report underscores 5 key healthcare activities to better address the SDOH and integrate social care with healthcare, so-called the 5 A's framework. These are the 5 A's: awareness, adjustment, assistance, alignment, and advocacy. Under the guidance of these activities, the 5 activities, and based on the available census data and other published statistics, we included the following 6 blocks of state-level variables for inclusion as potential determinants in modeling mitigation efforts. So these variables are shown here. There are 6 blocks of them. Each block contains multiple variables. Due to collinearity problem in regression analysis, we only use several of them from each block. So these blocks are the COVID-19 prevalence rate, demographic characteristics, economic well-being information, public health infrastructure, information related to politics, and international connectivity. Now I'm going to give the time to Linyun and Yuanyuan to present the procedure of content analysis and the findings of the determinant studies. Linyun, your time.
Hello, everyone. Thank you so much, Professor Guo. So I'm going to talk about the content analysis and findings. Our study wanted to explore both the determinants and impacts of social distance interventions in the States. So the first question we had was, what are those social distance interventions during our study window, which is from March 13th to April 7th. So the first step of this study was to understand all social distance interventions, including but not limited to the stay-at-home orders that governors in each state issued to reduce the spread of COVID-19. We used the qualitative content analysis to analyze large quantities of text data from governmental documents. So in total, we examined all relevant documents, 1,470 executive orders pertinent to the mitigation orders from the state government websites for all 50 states and Washington, D.C. You can see the upper left screenshot as an example of one executive order. Here's the stay-at-home order, actually, that Missouri issued. In this study, Yuanyuan and I were responsible for the whole review and coding process. 2 of us independently reviewed 1,470 executive orders from the governmental website and coded the categories and units as the first stage. Then both of us cross-checked our coding and achieved a 90% agreement. All agreement for the rest 10% were reached as a result of a well-developed protocol. Finally, 2 of us reached a 100% of agreement on all coding categories through continuous discussion and also comprehensive coding notes. We are confident that any third party could achieve the same coding results as we did based on the comprehensive coding notes we created. You can see the upper right screenshot there. We made lots of very specific and detailed notes. Here are just examples of coding notes we made in order to reach the consensus between 2 researchers, both of us. Strategies that could be undertaken only in certain areas like beach closure in Florida and California were excluded from the coding process. You can see the screenshot at the bottom, which is one example of our raw data. We listed the timeline of each state issuing the social distancing policies in a detailed way. Based on the comprehensive review and coding process, we identified 9 mitigation interventions. We also considered variation across states in the frequency of use of alternative mitigation strategies and the prior literature on social distancing in this process. Now I'm going to introduce you the 9 interventions that we identified from our content analysis. They are stay-at-home order, strengthened stay-at-home order, public school closure, all school closure, large gathering ban of more than 10 people, any gathering ban, restaurant or bar limits to dining out only, non-essential business closure, mandatory self-quarantine of travelers. We recorded the exact timing to implement each of these 9 interventions. We recorded even the hour when a specific strategy was implemented. A state that did not enact a particular intervention by the end of our study window, which is 6 p.m. April 7th, was considered censored for that strategy and was coded as having the longest time of 606 hours on lengths of time it took to enact the measure. Considering censoring under the current setting refers to the fact that the event of interest did not occur by the end of the study window, but might occur in future. This is part of the survival analysis. So the first one, the stay-at-home order. We coded the time, the date and hour of, Professor Guo, can you go back to the previous slide? Thank you. We coded the time issued by governors to urge, the next one, sorry, the next slide, the 9 intervention, yes. So this order is about to, like the governor, they issued the order to urge or require all residents in that state to stay at home, except for essential activities. In some states, it is also called shelter in place or safer at home order. The second one is strengthened stay at home order. We coded the time that more restricted social distancing strategies, including adding enforcement of stay at home order or like grocery shopping limits were issued. The third one is public school closure. We coded the time that governors formally closed all public K-12 schools. The fourth one is all school closure. It's about the governor formally announced the closure of all public and private K-12 schools. The fifth one is the restaurant and bar limits. We code the time of the first formal order that requires the closure of on-premises food and drink consumption and only allowed delivery, drive-through, and carry-out option. Large gathering ban of no more than 10 people. This coding captures the date and the hour that states first announced a prohibition of public gathering with greater than 10 people. Large gathering ban of any size, this coding captures the date and hour that states officially prohibited public gathering of any size. It's like a zero tolerance. Non-essential business closure. So we coded this one as governors formally ordered closed all non-essential business. We excluded those states that only issue non-essential retail business closure order. We also excluded those states who did not prohibited personal care and grooming business like barber shop, hair salons, beauty salons, nail salons, massage, and tattoo. The last one is a mandatory self-quarantine. We coded the date and hour on which the governors announced the mandatory self-quarantine of 14 days for all travelers from any other states. We excluded those states which limited travelers from certain areas only. So for you to better visualize the timing igniting the stay-at-home order, we made a GIS map. Yes, this one. From this map, the lighter the color is, the faster that the state issues stay-at-home order after the national emergency on March March 13th. For example, California, Illinois, Washington, Oregon, New York, and New Jersey are the states which issue the stay-at-home order at an early stage. The darker the color is, the slower that the state issue a stay-at-home order. For example, Florida, like our Missouri, South California, Alabama, Georgia, and Mississippi are the states which issue stay-at-home order in a relatively late stage. You may also notice from the map that there are states with the darkest color. They are the 8 states which did not issue stay-at-home order during our study window. Even until today, they have never issued the stay-at-home order. They are Wyoming, Oklahoma, Nebraska, North Dakota, South Dakota, Arkansas, Iowa, and Utah. The next table, next slide, we made, you can clearly see the time frame that each state issued their social distancing interventions. Whether they issued any measure in a relative early or relative late stage is clearly shown in this table. For example, the restaurant and bar limit intervention, you can see Kansas did not issue such policy, and Nebraska is the last state which issued this kind of intervention. So this table is very, very clear. You can find all the information you want to see. Now I will hand it over to Yuanyuan. She will be introducing our main research findings in this determinant study.
Thanks, Dr. Guo. Thanks, Linyun. And I'm going to share the 3 important findings of the determinant study. The first one is the major determinant. So the results indicate that COVID-19 prevalence rate, population size, unemployment, proportion of uninsured, poverty level of economic development, proportion of minority people, and public health infrastructure are the key determinants affecting the initiation of mitigation interventions. For the analysis of the determinants of each mitigation strategy, we adopted a proportional hazards model of survival analysis, which is known as the best statistical method for studying the timing of event occurrence with censoring data. And for the analysis of the overall determinants, put together all the 9 episodes of the mitigation interventions, we employed multiple event survival model, and which is a robust approach to control for the autocorrelations of study events. And the next slide, we introduce another important finding. This one implies that some states missed the optimal timing. We hypothesized that states initially with a high prevalence rate would enact mitigation strategies more quickly. But contradictory to our hypothesis, the results showed that states with a lower prevalence rate reacted more quickly to the outbreak. And the finding is statistically significant in all the 8 models of different mitigation measures we're going to talk about very soon. And the next slide, we shows the 8 different models, the 8 mitigation strategies, including stay-at-home order, public school closure, all school closure, large gathering ban of more than 10 people, any gathering ban, restaurant or bar limit to dining out only, non-essential business closure, and mandatory self-quarantine for travelers respectively. And here we present the model-based predictions of survival curves for all 8 mitigation strategies we just mentioned, and showing the impact of prevalence rate on the day prior to enacting a mitigation strategy. So in the figure, all the green lines at the top refers to the highest prevalence rate, and the blue lines at the bottom refers to the lowest prevalence rate among all the states. So let's first take a look at the first figure, stay-at-home order as an example. The green line, which is the highest prevalence rate, is at the top, showing a slowest speed, while the blue line representing the lowest prevalence rate is at the bottom, indicating the fastest reaction. That is to say, states with higher prevalence rates issued stay-at-home order slower than those with lower prevalence rates. And this finding helps explain why new case counts of the COVID-19 in the United States remain high for longer period of time than other developed countries globally. And this finding suggested that even following the national emergency declaration, some states did not react and missed the opportunity to prevent the spread of the COVID-19. And you can see throughout all the 8 figures, the pattern remains very similar. And for a better illustration, the next 4 slides, we're going to show you the descriptives of this finding. These figures represent prevalence rate of COVID-19 cases at the time 1 day before each mitigation intervention was enacted. So states on the x-axis are already ordered by the timing of enactment, with the states closer to the origin or to the left-hand side enacted earlier. And the y-axis is the COVID-19 prevalence rate. The yellow bars indicate states enacted this specific mitigation strategy, and the gray bars refer to states did not enact this mitigation measurement at the end of our study window. Again, we can take the first figure as an example, the stay-at-home order. We can see that these high bars representing states with high prevalence rate are mostly on the right-hand side, which means they took a longer time to enact a stay-at-home order. And we can also find that there are 8 gray bars. Those are the states never issued a stay-at-home order, just what Linyun mentioned. As all figures in the coming slides, clearly shows that those states are never, the states of higher bars are many on the right-hand side in the coming slides. Professor Guo, can you go down to the other slides? Yes, those slides, you can also say that the bars with the higher bars, there are many on the right-hand side. And all the figures shows states of higher bars and many on the, indicating that the higher the prevalence rate, the lower the speed, the slower the speeding moving to the enactment. And this pattern actually applies to all the 8 mitigation measures. Yes, here it shows actually they follow the very similar trajectories, that the higher bars are many on the left-hand side, on the right-hand side. Yeah, here as well. And the next slide is the third finding of this determinant study. And we found that states with a high percentage of minority people, high poverty rate, and a high unemployment rate enacted some mitigation measures in a rapid fashion. So the 3 figures on this slide display the survival functions of this finding. The first figure shows the impact of percentage of African American and Hispanic populations in 2018 on the non-essential business closure. And again, here the green line representing the states with highest percentage of minority people is on the bottom, which means they enacted a non-essential business closure the earliest. And the second figure explores the impact of poverty rate in 2018 on any gathering ban. And again, the green line referring to the states with highest poverty rate is at the bottom, which shows that states with highest poverty rate issued any gathering ban earliest. And the last figure is the impact of unemployment rate in February 2020 on large gathering ban of more than 10 people. We can also find that the states with the highest unemployment rate, the green line at the bottom, enacted the large gathering ban of more than 10 people earliest. So for, throughout the 3 figures, we find that the vulnerable population actually suffered most severely from the pandemic. This is also a very important finding, which means that the states with high proportion of vulnerable subpopulations encountered the business closure the earliest, encountered all the bad situations most severely. So recall, we got 3 findings of the determinant study. We first identified major determinants of enacting mitigation measures, and we also found some states have missed optimal timing of implement social distancing. And the last one, we found that vulnerable population suffered the most severely from the pandemic. And this concludes my presentation. Let's give the time back to Dr. Guo.
Thank you, Linyun and Yuanyuan. These are the findings from the determinant study. And in November 17, Dr. An will lead our team to present the second part about the impact, the findings from the impact study. In my view, 4 features or 4 findings make our study unique or valuable. Number 1, as Yuanyuan just said, we found that some states missed the optimal timing to enact the mitigation efforts. Secondly, we found that vulnerable populations suffered the most severely from the pandemic. The third thing we haven't talked about yet, but in our second presentation, my colleagues will do. That is, out of the 9 mitigation interventions, 3 of them showed positive impact on reducing the case and the death counts. Okay, 3 of them are good ones. Okay, I will let my colleagues to show the details in the future. The last feature or last finding is we really conclude that reopening economy should be implemented very, very carefully. Fully lifting mitigations will cause disaster. From a research point of view, this study also shows the power of using a mixed method approach. This is really the combination of a qualitative and a quantitative research approaches. Linyun and Yuanyuan did a fantastic job by examining 1,470 governmental documents, and they did also relevant literature review. Our team, Dr. An is an expert on public health. Dr. McBride, Tim McBride, is an expert about health policy. Dr. Yu is an expert on quantitative analysis. He spent much time on the impact study. And I also focused on the determinant analysis and using complicated statistical models, such as a Cox regression and multiple event survival model to study these determinants. Okay, so it's really, we really enjoyed the collaboration among us. And we also think this shows the powerfulness of mixed method. There are several implications we can draw from this study. Instead of doing that by ourselves, I'd like to hear from you, our audience, about the implications. I want you to think about 3 questions. Why states with the high COVID-19 prevalence rates enacted mitigations in a delayed fashion? What can we do to help the vulnerable populations? What are the implications of the Black Lives Matters and anti-racism movements under the setting of a severe pandemic? My thinking is that our finding about a delayed response to the pandemic in some states helped explain why the death counts of COVID-19 in the United States remain high for a long period of time, and why the US experienced the highest disease burden among the developed economies. Our study provided evidence that vulnerable populations, minorities, poor people, and unemployed populations suffered most severely from the pandemic. That is, they experienced an economic shutdown the longest time, which helps justify the significance of the Black Lives Matter and the anti-racism movements. I'd like to stop here. Thank you all. Now we are ready to address your questions.
Thank you so much, Dr. Gao and panel. Fantastic information, and certainly want to invite folks to jump in on the chat. We've got some nice compliments for you about the value of your work and thanking you for your leadership on this topic. I want to ask a clarifying question, something that I thought you were saying we might get to in part 2. And if we are, then it's not a question for today. But if we're not, then it would be a good question for today. It sounded like perhaps the 9 different interventions, part of the analysis is an understanding of which of those interventions were most effective at reducing case count and death count. Is that correct?
Yes, I can share that information first. We found that 3 out of the 9, we found 3 of them are effective in reducing 5 outcome variables. So our outcome variables are basically per 10,000 population count for the confirmed cases, new cases, and deaths and the cumulative deaths. There are 5 of them. And also we divided the cumulative counts by, we divided the number of deaths by the cumulative cases. So we also have a death rate. So out of the 9 mitigation interventions, 3 of them showed effectiveness on reducing the case count and the death rate. They are large gathering ban of more than 10 people, restaurant bar limit to dining out only, and non-essential business closure. I will let Dr. An to discuss the implications later in his presentation, but I will call your attention on all these 3 mitigations. You can see these mitigations all center on reducing social gathering, reducing social interactions, reducing crowding. So to some extent, these efforts are very, very important. Shortly after our study, after May 29, when our study published by medRxiv, some states lifted the mitigations and re-adopted the mitigations. When I watch CNN, I remembered it clearly that Texas and Florida re-adopted the restaurant and the bar limitation. Thank you.
So we have a question from Peggy. She's a Brown School alum joining us, and she says, thank you for your work, but she's confused and wants to shine a little more light. If a state already had a high unemployment rate and low prevalence rate, would closing business make matters worse? Or is she missing something in that analysis?
That's an excellent question. So basically, for each one of these 9 mitigations, we use the timing each state issued or each state enacted the order for each one of these. That is our dependent variable. And we use one variable we define as the prevalence rate. That is the count, the COVID-19 case 1 day prior to the enactment, okay? 1 day prior to, each state varies by the timing of enacting these mitigations. But we carefully documented the count of a COVID-19, cumulative count by that time, 1 day prior the enacting the mitigations. We hypothesized that because of the theoretical framework, right, awareness of the problem threatening to our public health. So we hypothesized that the states with a higher prevalence rate, higher number of cases per 10,000 population would enacted an intervention early, but that is not the finding. It is the opposite. It is those whose case count at a lower level 1 day prior to the enactment adopted the intervention early. And that finding is significant for all 8 models. On all these mitigation interventions, we found that pattern. So that's why we say this helped explain why the COVID-19 cases in the United States remained high for such a long period. Why we suffered such a, the worst disease burden among the developed economies.
It is a super interesting puzzle and significant finding, helpful finding. A question, this is mine, because I'm trying to understand a little bit the characteristics of the states that reacted quickly and those that didn't. Mm-hmm. It seems to me that some of the states that have this high prevalence and did not respond quickly are also relatively low population and may have had a low raw count, and that some of the states that responded quickly are high population, high raw count, but low population prevalence. Am I more or less on the right track, or is it, how do you discern that?
Well, thank you very much. That's exactly what I wanted to hear from our audience. Thank you, Janet, for this information. In general, I agree with you, but also we found some of those states, who adopted the mitigations later are also suffering from the pandemic. They also have a high, they not only they are small in terms of the population size, but also, well, you probably you can see like Florida, like some of those states, I think also, well, they are small, but also some of them are economically developed states, I would say. Yeah. So so it's a combination. I think probably the low population density also an important factor. I agree with you.
So there's an interesting question, comment coming in on the chat. Ms. Yang said that vulnerable populations suffered most severely from the pandemic. It's already well known that African American and Hispanic populations and poor people were more likely to get sick from and die from COVID-19. So I think her statement is about the economic suffering. But isn't it possible that early mitigation strategies in places with larger minority populations or poor populations may have actually reduced the spread of disease and therefore reduced the suffering in these populations? So I guess it's the tension of suffering economically and suffering effects of the disease. Is there anything that you would like to share by way of further discussion on that point, since it seems like it's of interest to the audience?
That is an excellent point. I think what we found was the states with a high percentage of minorities, both African American and Latino populations, and the states with a higher poverty rate, and the states with a higher unemployment rate in February of this year enacted mitigations early. Okay, so obviously those states are already poor, with a high percentage of minorities and a high percentage of unemployment. They suffered the most, because they started they experienced the shutdown for the longest period of time. So when we first got this, it was just the Floyd event happened, in this country, we started the Black Lives Matter movement. And we think, those angers, are not coincidental. And those vulnerable populations, have a good reasons to express their appeals for social justice, for anti-racism. So this really helped to explain the social justice for these movements. Yuanyuan and Linyun, would you like to add something?
Yes, thanks I think this is a very good question. And yes, just follow with what Dr. Guo just said, because for those vulnerable populations, they experienced the longest shutdown period. So they are more likely to suffer the economic disadvantages during this specific time. And as well, it might be, but it's not in the scope of this determinant study. It might be possible that because they shut down it in the fastest fashion, so they have lower probability to get infected, but it's not under the current studies umbrella. So there is the trade-off. It's the economic loss as well as the public health concerns. So there is always a trade-off between those two.
Thank you for that. So another question raised by Brady, and this gets to the multivariable analysis that you were doing. I recall that politics was one of the bundles, and I'm just curious for a little more detail and discussion of how politics were quantified, used as a variable. Were you thinking in terms of red states and blue states, or some other way of factoring in governmental decision making, and how that might have impacted mitigation efforts?
That's an excellent question. I think for politics, we used several variables for that block. We used whether or not the governor is a Republican, that's a dummy variable. And we also used the percentage of the state senator, percentage of Republican in the state senator. And also we used the 2016 election result, to represent the politics for the state. I don't think these variables are significant from our studies. Okay, let me double check. From the major, this is a summary of the major determinants. No, I was right. None of these politics variables are statistically significant. This does not mean they are not important. This is simply from our data set. From a multivariate analytical point of view, by controlling for all other variables, these politics variables do not show significance.
So curious about the role of local government The study has referenced a great deal stay-at-home orders and things issued by the governor. Mayors and county executives sometimes have been more restrictive. How does the study factor in that rules were not always uniform across a state?
That's an excellent point. I think this is a study we conducted at the state level. So the unit of analysis, there are 51 of them, 50 states plus Washington, D.C. So this is actually a limitation of our study. We cannot take into consideration the big variations at the sub-state level, at the county level and the city levels. You know, there are more variations, you know, at that level. But we couldn't do that. You know, the current study just conducted at the state level. That is a limitation of the study. But actually, it is true that there are lots of variations at the sub-state level. You know, at the county commissioners and the city mayors, you know, may have a different, you know, may enact additional mitigations, you know, at the county level and the city level.
Thank you. So time for one last question before giving you all an opportunity to do a closing comment if you'd like to. The implications of the study for mitigation, it sounds like we're going to get to a lot in part 2, that you have found 3 of your 9 mitigations were statistically significant. But you had also mentioned implications for reopening, that reopening needed to be done carefully. And so I'm curious, given the study, what thoughts, even if you're not able to say with certainty that statistics support, what thoughts you came away with as far as what does careful and good reopening look like?
That's an excellent question. We don't know.
Okay.
So basically, at the end of our study, I think when we concluded our study, I think in early May, many states already started to reopen the economy. And many states already started to lift some of these mitigations. I think today, you know, all the states in the United States already lifted, you know, either partially or fully. Okay, so this is our next study. So we also wanted to investigate the joint impacts of enacting mitigations and lifting the mitigations on COVID-19 case counts. So this is our next study. And but the message is clear. Reopening economy should be implemented very, very carefully.
We are nearly at time. Is there any sort of final thought that you want to leave the audience with before we go?
I don't have. Linyun and Yuanyuan, do you?
I think this is an excellent study. It's like a transdisciplinary study. We have a Brown School, like I feel so lucky to be part of this study because we have public health expert, social work expert, and also health policy expert, so we can do this together. I think this is the advantage of us for studying at Brown School and also learn more about research at Brown School. Yeah, I really feel very grateful. Also, thank you all, everyone, for coming to listen to our lecture.
For our audience, our students particularly, if you have additional questions, please feel free to send us your questions via email. Thank you all very, very much for attending today's open classroom. And thank you, Janet and Gary, for organizing this.
Well, it has absolutely been our pleasure. I likewise feel grateful to be a part of this team, and I'm just so delighted to spend this time with you. Thank you for a really informative talk. And I'm excited for part 2, where we can delve yet further into what you learned and the implications of it. So thank you so much for speaking to us, and thank you to the audience for joining us, and we hope to see you soon at another open classroom. In the meantime, please stay healthy and safe, everyone. Take care now.
Thank you.